Hello friends, I am Dr. Beast speaking. I am an emergency medicine qualified doctor as well as I am also ENT surgeon. I have qualifications in public health also. So in these videos I will tell you about a very important aspects of life that is called basic life support, BLS. So everybody should know the BLS protocols or the steps to save a life. Irrespective of your qualification, you can save a life anywhere, in public place, in school, in market, in a train journey or a plane flight. Everywhere you can get emergency situations. Suppose a person suddenly becomes unresponsive and become unconscious or unresponsive or fell down. In that case, what should you do? It's very important. It may happen at your home, in neighborhood, in your relative, everywhere you can get, anytime, at any moment, at any place you can get the situation like this. So we should know it. So what to do? Basically, BLS, basic life support, are some steps, some assessments, some procedures, and some steps. You don't have to have any sophisticated medical equipments, any drugs, any medicines. You don't have to have those things. But with your knowledge in BLS, you can save a life. So friends, how to proceed? Suppose a person is not responding. Okay. First of all, you have to see the scene safety, the environment where the person is lying down or fell down. Whether there is any danger, like a live electric wire is there, or some wild animal, or any fire. That is very important. The scene safety. First of all, you need to see whether there is any danger, imminent danger is there or not. You have to take that persons out of the danger. Suppose some live electric wires is there, you don't touch, because you have to have your own protection also. So if there is, the scene is very much safe, first of all you have to do is to activate emergency medical service. To activate emergency medical service, what you do? If there is some persons, you just call him, you ask him, hey, you call the emergency medical service. Or if you have any mobile cell phone, you just activate the emergency medical service. Call the 911 or any emergency number with respect to your countries. So after that, you go near to the persons, you ask him, hey, how are you? Can you breathe? How are you? Just check him. If he is not responding, you assess. You assess for the breathing, okay? Breathing and pulse. Simultaneously, you assess for the breathing and pulse. You should take at least 10 seconds. Within that, you have to assess whether breathing or pulse is there or not. So for checking pulse, what do? You can put your thumb like this into this carotid. This is called carotid pulse here. Or you can put your middle finger here and assess the pulse. If the person is not breathing and there is no pulse, you have to start CPR. That is also known as cardiopulmonary resuscitation. So for assessment of the breathing, what do? You just put your ear in front of the person's mouth and see whether there is any sound, breathing sound, you can assess or not. Or you can also look his chest movement, whether his chest is moving or not. Remember that you don't take much time in assessing this pulse and breathing. within 10 seconds you have to assess it. And if you don't get any pulse or any breathing movement, you have to start cardiopulmonary resuscitation. So, what is cardiopulmonary resuscitation? This is a combination of breathing technique as well as chest compression. So, for chest compression, what do? You put your both hands like this, then at the lower end of the chest you put both the heels of your hands and press the chest like 1 2 3 4, and the chest compression should be so that the pressure of compression should be adequate, so that there is chest movement at least 2 inch in depth. Okay, and the rate of the compression should be at near about 100 per minute. So you count 1 2 3 4 5 6 30, you count down to 30, you count up to 30, then if you are a single person, then you have to give him rescue breathing. For rescue breathing, what do? You put your hands like this, fold, and keep the tube on the patient's mouth, and you have to do the mouth to mouth breathing. Or if you have any handkerchief, you just place it over his mouth and you have to give the breathing. So your mouth should be like that, so that there is no any air leak. You have to blow, and the blow should be like that. The movement of his chest should be there. You give 2 blows. Okay, 2 blows, 2 deep. You take first of all you inhale and blow within his mouth, so that there is chest movement. Okay, so you give 2 subsequent breaths, and again start the CPR. CPR means the chest compressions. Again you have to start the chest compressions. So this cycle you should continue it for 2 minutes or 5 cycles. 30 chest compression and 2 breathing. 30 chest compression and 2 breathings. Okay, for 5 cycles, that is for 2 minutes. After that you have to again reassessment. You have to do reassessment. Again you have to look for the pulse and the breathing sound. Okay. So this is very important. If you get the pulse and the breathing becomes normal, in that case you have to wait for the emergency medical response teams and keep the patient or that persons in a safe place, in a recovery positions. What is recovery positions? You have to keep the persons in left lateral positions. Okay. And suppose if in that condition where you are getting the pulse but there is no breathing. Okay, you are getting the pulse but there is no breathing. In that case, what do? You have to give rescue breathing. To give rescue breathings, again you have to inhale first and place a hanky or handkerchief on that person's mouth, and you seal your mouth and you blow. You blow such that he is having his chest movement. Okay, you do 2 such breathings, such blow, and reassess. If pulse comes, then again you have to keep the person in recovery positions. Okay, and if the pulse is not there, then again you have to restart the chest compression. So if there is pulse and breathing, you have to wait for the emergency medical service or AED. What is AED? Automated emergency defibrillator. Okay, we have to wait for the AED. So you have to keep this cycle on and on. If the person is not having any pulse, no breathing movement, you go for 30:2 30 chest compression and 2 breathing. 30 chest compression, 2 blowing, rescue breathing. You go on this cycle, keep keep these cycles for 5 minutes, for 2 minutes, and 5 cycles, and wait for the EMS service. So this is very important. You can save many lives by doing these steps only. Okay, friends. So subscribe my channel. I will continue giving tips and tricks of different health aspects related to ear, nose and throat, any emergency first aids and emergency medicine situations, and all other health related, preventive health related conditions. Okay, thank you for giving your time. Bye.